Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the muscles of the back of the thigh. These are also called hamstring muscles. Okay, hamstring muscles are the muscles of the back of the thigh. Okay, these are the semimembranosus, membranosus, semitendinosus, long head of biceps femoris, and the hamstring part of the hamstring or ischial part of the adductor Magnus. So we got the hamstring muscles, semimembranosus, semitendinosus, long head of biceps femoris, hamstring or ischial part of the adductor Magnus. They have some common characteristics. We learn what are the common characteristics of the hamstring muscles or muscles of the back of the thigh. Okay, so common characteristics. Okay, so number one, all of them originates from the ischial tuberosity. Ischial tuberosity. Okay, so this is the ischial tuberosity. Ischial tuberosity. Okay, this is ischial tuberosity, and all the hamstring muscle takes origin from the ischial tuberosity. That is, all of them takes origin from the ischial tuberosity. This is the ischial tuberosity, site of origin of all of the hamstring muscles. Okay, we got one characteristic. Another one is that they are innervated by the tibial part of sciatic nerve. Tibial part of sciatic nerve. Sciatic nerve. Okay, we got the tibial part of sciatic nerve, L5, S1 and S2 root value, and they are weak extensor of the hip joint. Okay, they are weak extensor of the hip joint. The strong extensor of the hip joint is the gluteus maximus. So our hamstring muscles are weak extensor of the hip joint. Okay, strong flexor of the knee joint. Strong flexor of the knee joint, with exception of adductor magnus, because adductor magnus is a special type of hamstring muscle. Okay, it has two parts. One is the adductor part, another one is the hamstring part. Hamstring part inserts into the adductor tubercle, as because the adductor magnus does not crosses the knee joint, so it has no action on the knee joint, but it work on the hip joint. It is like other hamstring muscle, weak extensor. It is an adductor, also a flexor and medial rotator. We'll go there of the thigh joint. Okay, but adductor magnus does not flex the knee joint because it does not cross the knee joint. If a muscle don't passes over a joint, that muscle does not work on that joint. So we got the common characteristic of all the muscles of the hamstring group. Okay, then they inserts another characteristic. They inserts to the bone of the leg. Okay, we go there, with exception again the adductor magnus inserts to the femur, and the hamstring part inserts to the adductor tubercle of the femur. Adductor magnus does not insert to the tibia or fibula, but other muscle, the semimembranosus. Here is the semimembranosus, membranosus. Here is the semitendinosus, and biceps femoris. They are inserting to the bones of the leg. So this inserts to the medial condyle of the tibia. The semitendinosus inserts to the upper part of the medial aspect of the tibia. Biceps femoris inserts to the head of the fibula. So this is the muscle. This is our biceps femoris, and this muscle inserts to the fibular head. Okay, we'll go there. And here is the semitendinosus. This is semitendinosus, and it inserts to the upper part of the medial aspect of the tibia. Okay, and this is semimembranosus. This part, that part, both part are part of the semimembranosus. Okay, this should be the adductor magnus, part of the adductor magnus. Okay, so if we write here, this is the adductor magnus. Okay, we go there. This is the adductor magnus, a big muscle. We are seeing small part here, adductor magnus, and all of them takes origin from the ischial tuberosity. Here, these muscles, the semitendinosus, inserts into tibia. Okay, we got it. So now we got common origin, common action on the hip joint, and common action on the knee joint except adductor Magnus. Okay, it does not work on the knee joint, it work on the hip joint. Okay, so this is the muscle, does not cross the knee joint, doesn't work on the knee joint. Adductor Magnus, it ends in the adductor tubercle of the femur. Okay, we got that. All other muscles are strong flexors of the knee joint, weak extensor of the hip joint. Okay, we got that muscles. Now we go again to the individual muscle. First of all, go to semimembranosus. Semimembranosus. This is the semimembranosus muscle here. This is semimembranosus. This part is also semimembranosus. Semitendinosus is over the semimembranosus. Its name is semimembranosus because its origin is membranous. It is semimembranosus. Origin is from the ischial tuberosity. Ischial tuberosity. From where? Of the ischial tuberosity? From the superlateral aspect of the upper part of superlateral impression of the upper part of the ischial tuberosity. Okay, insertion of the semimembranosus, insertion to the groove on the posterior aspect of the tibia. So this is our tibia, and we have groove here. This is the medial condyle. This is the groove. This is the site of insertion of the semimembranosus. Okay, this is the site of impression of the site of insertion of the semimembranosus. Okay, we got origin, we got insertion to the medial condyle of the tibia, posterior aspect in a groove. Okay, posterior aspect of the medial condyle of the tibia. Okay, tibia, we got it. Nerve supply. Nerve supply is common nerve supply, that is tibial part of sciatic nerve. Tibial part of the sciatic nerve. Sciatic nerve. Okay, root value L5, S1 and S2. We got that. Then action of semimembranosus. Again, weak flexor of the hip joint, strong, again weak extensor of the hip joint and strong flexor of the knee joint. Okay, plus semimembranosus also rotate the thigh medially. So weak extensor of the hip joint, strong flexor of the knee joint and medial rotator of the thigh. That is the action. Okay, we got action. Weak extensor of the of what? Of the hip joint. Strong flexor of knee joint and medial or internal rotator of the thigh, medial rotator of the thigh. Okay, we got the semimembranosus muscle. Now we go to the semitendinosus muscle. Okay, semitendinosus. Okay, origin again from ischial tuberosity. From which part? From the inferomedial impression of the upper part of the ischial tuberosity. Okay, insertion of the semitendinosus, insertion to the medial aspect of the upper part of the tibia. Medial aspect of the upper part of the tibia, and it is a component of the pes anserinus, 3 muscle inserts to the upper part of the medial aspect of the tibia here. Sartorius, gracilis, semitendinosus. Sartorius, gracilis, semitendinosus. Okay, so this is the tibia, upper part of the medial aspect. This is the semitendinosus. Semitendinosus. Okay, this is sartorius. This is gracilis. They form the pes anserinus. Okay, or anserine insertion of the 3 tendons, sartorius, gracilis, semitendinosus. We got the insertion. Nerve supply, same, tibial part of sciatic nerve, L5, S1, S2. Action, weak extensor of the hip joint, strong flexor of the knee joint, and medial rotator of the thigh. We got the semitendinosus. Okay. Now we go to the biceps femoris. Biceps femoris. Origin from the ischial tuberosity along with the semitendinosus. There is the inferomedial impression of the upper part of the ischial tuberosity. That is this part. Okay. This is semimembranosus, semitendinosus. This part will get the adductor, Magnus. We'll go there. Okay. We got the origin. Insertion of the biceps femoris. Okay. Origin will get one origin. This is the origin of the long head. Long head origin. Okay, how about short head? It has short head origin, long head here, short head. From where it will come? Short head of the biceps femoris. Short head takes origin from the linea aspera. Okay, so this is long head, short head origin from the head should come from the linea aspera on the posterior aspect of the femur. Okay, linea aspera and part of the lateral supracondylar line. Okay, so this is the linea aspera and this is the lateral supracondylar line. So this part, site of origin of the short head of the biceps femoris. Okay, 2 head, long head. Long head come from the ischial tuberosity. Short head is coming from the linea aspera that is present on the posterior aspect of the femur. Okay, we got that. Nerve supply, it has 2 head, so 2 nerve supply, double nerve supply. So if you go to the nerve supply, long head, again long head, like all other hamstring, nerve supply should be tibial part of sciatic nerve. Okay, root value L5, S1, S1, S2. Okay. How about short head? What is the nerve supply of short head? Short head nerve supply, common fibular part or common peroneal part of the sciatic nerve, common fibular or common peroneal part of sciatic nerve. Okay, root value same, L5, S1 and S2. Action, biceps femoris, hamstring, long head is hamstring, so weak extensor of the hip joint, strong flexor of the knee joint. Now it rotates the thigh laterally, so lateral rotator of the thigh. Now what is the insertion of the biceps femoris? Insertion, we got origin, short head, long head, nerve supply, short head, long head, action, but we have to cover insertion of biceps femoris. Insertion. Insertion of the biceps femoris to the head of the fibula. This is the head of the fibula. Here it surrounds the fibular collateral ligament. It is inserting to the anterior part of the apex of the head or stellate process of the head. Here is the site of insertion. It surrounds the fibular collateral ligament. Even the fibular collateral ligament may split the tendon of insertion of the biceps femoris. So, the site of insertion is here at the top of the head of the fibula, around the fibular collateral ligament, in front of the apex of the head or stellate process of the head of the fibula. We got the insertion. Okay, fibular head. Okay, we got insertion. We got nerve supply action. Okay, then we have one more muscle that is important to us. That is the adductor magnus muscle. Okay, adductor magnus. Adductor magnus has hamstring part. Origin, if you go to the origin, hamstring part that originates from the ischial tuberosity. Which part of ischial tuberosity? Lower part of the inferolateral impression of the ischial tuberosity. So it takes origin from the here lower part of the inferolateral impression of the lower part of the ischial tuberosity. Okay, we got the origin hamstring part. Okay, how about the adductor part? Adductor part takes origin from the rami of you can say the ramus of ischium and inferior rami of the pubis. Okay, nerve supply, double nerve supply, because two part nerve supply. Okay, nerve supply is for the hamstring part, that is tibial part of sciatic nerve. Okay, let's say hamstring part that gets nerve supply from tibial part of sciatic nerve. Okay, sciatic nerve, and its root value should be L4. Okay, another part is the adductor part. Adductor part is nerve supply from obturator nerve, posterior division of obturator nerve, posterior division of obturator nerve, and that's root value is L2, L3, L4. Okay, we got the nerve supply, we got the origin. Now we go to the insertion of the adductor magnus. Insertion, very long insertion, the lower part of gluteal tuberosity of the femur, lower part of the gluteal tuberosity of the femur. Okay, then the linea aspera, then medial supracondylar line, medial supracondylar line. Okay, and the hamstring part inserts to the, this is the adductor part insertion, hamstring part inserts to the adductor tubercle. So this is the adductor magnus, adductor magnus. Insertion. This is the adductor tubercle, adductor tubercle. Okay. This is the origin of the biceps femoris, short head, biceps femoris, short head. Okay, we got that. Now, what is the action of adductor magnus? Adductor magnus action is important to us. Adductor magnus. Okay. Adductor magnus, this is a muscle, is an adductor muscle. It will adduct the hip joint, adducts hip, flexes hip. This is the adductor part. Also medially rotate the hip. Medially rotates the hip. This is the adductor function. How about hamstring function? Again, weak extensor of the hip joint. Weak extensor of the hip joint. That is the hamstring part of the hip joint. Okay, we got all the muscles. So this is the adductor part, adductor function. This is the hamstring function, hamstring function. Okay, we got that. Now we learn. We have gone through all the hamstring muscles in the back of the this is the gluteal tuberosity, insertion of adductor magnus, linea aspera going to the adductor tubercle. Okay, this is the insertion of the adductor magnus. This is the origin of the short head of biceps femoris. Okay, we got that coming also from the linea aspera. We got the hamstring muscle. Now we learn some clinical anatomy. Okay, so clinical anatomy, that is important. This muscle is very much vulnerable to injury, the hamstring muscle. So there is hamstring injury. Injury due to any sports and game that use this muscle, sports and games like running, sprint, football, baseball, hockey, or even kickboxing. Okay, so we need this muscle, and we may have damage, especially in the proximal part. There may be damage, and it's because it is covered by the fascia lata. There will be hematoma here. There may be tear in the muscle fiber. There may be hematoma that swelled up inside the fascia lata, that may be very much painful, and the player cannot walk, just lie flat on the field. Okay, so hamstring injury is very common. Or we may have even, there may be avulsion of the ischial tuberosity. Okay, in certain condition that may happen. Tuberosity due to sudden kick or sudden movement, especially in an unconditioned player, or maybe conditioned player with very much strenuous movement of the muscles. Okay, that may happen. There may be pull, there may be injury, there may be avulsion of the ischial tuberosity. That's all about the hamstring muscle. If you like my video, please support my channel. Share the information with your friends. If you have any question, please let me know. Support my channel, subscribe me, and have a nice day. Bye now.